Hi, I'm Richard. I'm a speech and language therapist and a lecturer based in the UK. In today's video, I'm going to show you how to use drawing to explain what aphasia is to someone with aphasia, say after a stroke, or even to their family members or other professionals. Drawing is often used as part of what we call a total communication approach to aphasia, where you can use a range of modalities and strategies to get your message across by any means possible. Now, aphasia is an acquired language disorder that affects someone's ability to communicate. This might include someone's ability to understand spoken words and sentences, their ability to read, to talk, or to write. If I think about a person with aphasia, I might use drawing to explain aphasia because they cannot understand my verbal explanation of what it is. They might struggle to read leaflets or websites that contain relevant information about the condition. They might struggle to ask or write down questions to clarify something I've said, or to ask follow-up questions to get more information. There are also a couple of other benefits to using drawing, which I'll explain later in the video. Now, I'm going to use a drawing tablet, but as you will soon see, the quality of the drawing is really not important. You'll be able to do this with a pen and piece of paper at the patient's bedside in a hospital or in someone's home. The first thing I would do is start by drawing the brain in the middle of the page. This does not have to be detailed or anatomically correct, so long as the person understands what it is. You can always use gestures to point to the skull to make sure they understand what you're referring to as well. You can always add more detail for those people who want more technical explanations later on. I'm going to show you a more complex picture that I drew earlier to show the lobes of the brain as well as the cerebellum and brainstem. This level of detail may be necessary if someone has a less common kind of stroke that affects the posterior circulation of the brain. So here, again, I've illustrated the frontal lobe, the parietal lobe, the temporal lobe, occipital, the cerebellum and the brainstem. Let's go back to our original drawing. Now, the reason I just draw a brain and not the brain inside the skull or connected to the body is because it hopefully stops people thinking that their aphasia is due to some kind of muscle weakness or incoordination in their larynx, tongue or lips, etc. These can be impaired after a stroke, but these are different conditions, not aphasia. Now, the second thing I would draw is the activity which people do most often when using language. I would start by drawing an ear to symbolize understanding. This is one of the most difficult aspects of aphasia to communicate to somebody, as the issue is not that the person cannot hear the word being spoken, unless they also have a hearing impairment as well, which is common in older people especially, but rather that they do not recognise previously known words or cannot understand the words that they do hear. I would then add an arrow pointing towards the brain to show that this is an input. The brain processes and makes sense of what the ear hears. I would also write down the word understanding underneath the picture so the person has different ways of potentially understanding the point I'm trying to get across. I would then move on to draw the other activities. A book to show the activity of reading, and again write the word below it. Now, some people might not read books very often, so you can use magazines, newspapers, comics or manga, whatever is most appropriate for the individual person. But I would avoid drawing pictures of things that could be used in several different ways. For example, most of somebody's day-to-day reading could actually be reading messages or social media on their phone, but they also use their phone to listen and speak when they're on a call. The same applies to things like tablets or Kindles, which can either be used for multiple things or look very similar to other devices in the case of the Kindle. Sometimes there is a benefit to using more generic or stereotypical images like a book to get your point across because they can only be interpreted in one way. Books are for reading. Now I would move to the bottom of the picture. I would draw a person's head with a speech bubble to show the activity of speaking or talking. You could potentially use a speech bubble on its own, but I prefer to be as explicit as possible. You could potentially leave the speech bubble empty or to individualize it, you could add specific examples of language errors or paraphasias you've heard the person produce, either in conversation or from an assessment. If you have space and your drawing skills are good, you could perhaps attempt to add a thought bubble to illustrate the word the person was trying to say, or if the person's reading is less impaired, you could write the words instead. I'm going to show you an example that I drew earlier using writing inside the speech bubble and thought bubble to illustrate a semantic error or paraphasia. Going back to the original drawing, I would add an arrow leaving the brain to show that talking or speaking is an output. And finally, I would add another modality, another activity, using a pencil or a pen to show the activity of writing, which is fairly self-explanatory. Now this drawing is obviously simplistic. It does not consider the person's understanding and use of gestures or more complex pragmatic language which can be affected in aphasia too, but it conveys the main gist of how the condition might affect most people following a stroke. At the outset I mentioned there were several other benefits to using drawings to explain what aphasia is. By drawing a diagram from scratch, you introduce only a small amount of information, bit by bit, to help someone understand. You can then clarify any misunderstandings as you add more and more detail. It is sometimes difficult to know for certain what someone with aphasia understands, so this definitely helps break that process down. Another benefit to drawing from scratch is that you can draw pictures that are more relevant to the individual and, as mentioned above, clearly include specific errors that they make. Because the drawing remains on the page, you can reduce working memory demands so someone is more likely to understand a message, unlike a spoken explanation, which can sometimes be not heard, it can be misheard, misunderstood, or they just forget very quickly. Because you are likely explaining things as you draw, the person is also benefiting from the information being given in multiple modalities, which improves their learning. Now there are also some more subtle benefits in terms of someone's wider management. By drawing 4 different activities with arrows going into or leaving the brain, you can easily introduce some basic clinical terms like receptive and expressive aphasia. So here on the diagram, again I would be thinking about receptive aphasia because someone's understanding and reading is impaired. Again towards the bottom, if someone's talking or writing were impaired, then I might use the term expressive aphasia. You are also introducing the idea that different communication activities functionally independently of one another, what we call functional modularity. So someone's reading and writing might be impaired, but their understanding and speaking is relatively unimpaired. This is important if you go on to use more formal assessments which are underpinned by cognitive neuropsychological models of language, such as the CAT or PALPA. You can explain in simple terms what each subtest is assessing by moving your finger or pencil along different parts of the picture. In terms of therapy going forward, you can also use drawing to see whether the person is aware of their strengths and weaknesses. You can get them to add ticks or crosses to the activities. So for example here, if someone's understanding was okay, then it could be a tick. Whereas if they noticed that they had some issues with their talking, they could put a cross. You could also use it for goal setting by getting them to identify which activities are the most important to them. So there you have it, how you can use drawing to explain what aphasia is. Hopefully I've shown you that you don't have to be an artist by any means to use drawing as part of your clinical practice. So if you found this video useful, give it a like and subscribe to receive notifications about similar videos in the future. If you've got any comments, questions, or have a request for other strategies or therapies you would like me to cover, then let me know below. Otherwise, thanks for watching and take care.